11 Ulcerative colitis symptoms you should know about. When it comes to ulcerative colitis, it's important to know the warning signs so that you can get treatment quickly. Most people are familiar with ulcerative colitis as a disease of the digestive system. However, there are a number of other symptoms that could point to ulcerative colitis, and you may not even know you have it. Ulcerative colitis is a chronic disease of the colon that involves inflammation and thickening of the intestinal lining. Ulcerative colitis symptoms usually appear gradually over several months, often causing abdominal pain, diarrhea, and fatigue. Ulcerative colitis is usually diagnosed using a combination of a patient's symptoms and medical tests. The main cause of ulcerative colitis is unknown, but some evidence suggests it may be caused by genetic susceptibility. What are the signs of ulcerative colitis? Here is a list of 11 symptoms that you may notice. 1. Upset stomach. If your stomach is constantly upset, you may be experiencing symptoms of ulcerative colitis. Symptoms include nausea and bloody diarrhea. The cause of ulcerative colitis is unknown, but some studies suggest it is due to bacteria. Other causes of ulcerative colitis include a viral infection or medications. When you have ulcerative colitis, your immune system attacks the lining of your colon and rectum. The disease can lead to complications like blood in the stool, fever, loss of appetite and weight, and rectal bleeding. 2. Abdominal pain. One of the most common symptoms of ulcerative colitis is abdominal pain. Pain is the number one symptom of ulcerative colitis. Symptoms are usually most severe during the first part of the day, particularly after waking up, after a bowel movement, and when lying down. It is also possible for abdominal pain to be a symptom of irritable bowel syndrome, a different form of chronic intestinal inflammation. 3. Frequent trips to the bathroom. Many people with ulcerative colitis are familiar with this symptom. The condition causes inflammation of the large intestine and rectum, which causes frequent visits to the bathroom. Because of its frequency, doctors often call it the number one symptom of ulcerative colitis. However, it may be more common than you think. The American Gastroenterological Association reports that a third of ulcerative colitis patients experience one or more episodes of bloody diarrhea every year. 4. Blood in stool. Although you may not think of blood in your stools as a symptom of ulcerative colitis, the redness and presence of blood can be indicative of a flare-up of the disease. While bloody stools are a common symptom of the condition, you shouldn't worry too much about it. A bloody stool that contains mucus or pieces of food is still considered to be a normal amount, so there's no need to rush to see your doctor. 5. Nausea. Most people think that diarrhea is the only symptom of an ulcerative colitis flare. While that's true, it's not the first symptom. Nausea and vomiting are also symptoms of the disease and often occur before any other symptoms. This is the reason that if you have an early warning sign of a potential flare, it's important to keep an eye out for any of these early warning signs to avoid missing any symptoms of a flare. 6. Low-grade fever. This is a common symptom of ulcerative colitis. It is also known as a low-grade fever, which indicates that you're experiencing a mild, low-grade inflammation in your colon. When you have a flare-up, your symptoms may include bloody stool, frequent bouts of diarrhea, stomach cramps, bloating, and pain in your lower abdomen. 7. Weight loss. People who are dealing with ulcerative colitis have a higher chance of developing a type of cancer called Crohn's disease. However, many people experience weight loss and stomach pains without a diagnosis of ulcerative colitis or Crohn's. What you can do to treat this symptom of ulcerative colitis is to look for foods that are healthy for your body. Some of the foods that can help include broccoli, kale, spinach, apples, almonds, and beans. If you do develop ulcerative colitis, the disease is treated with drugs, which are very effective. 8. Diarrhea. Diarrhea is a symptom of ulcerative colitis. What exactly does that mean? This is one of those topics that's likely to elicit a lot of differing opinions, so it's important to understand what causes this type of diarrhea. Diarrhea, also referred to as diarrheal, is the movement of fluid from the small intestine to the large intestine and back again. The causes of diarrhea vary, but generally, they are categorized by severity. 9. Sore throat. The reason why many people suffer from a sore throat, or hoarseness, after eating may be because the body tries to fight off bacteria in the mouth or throat with saliva. This bacteria can enter the bloodstream, which can result in a bacterial infection or inflammation of the lining of the stomach or intestines. The main symptom of ulcerative colitis is inflammation of the large intestine. People who have ulcerative colitis have recurring episodes of pain and diarrhea, which is sometimes bloody. 10. Headaches. We all have headaches from time to time, but when these headaches become recurring and occur in large numbers, we need to see a doctor. Headaches are among the most common symptoms of ulcerative colitis and can occur with other gastrointestinal issues. When your headache doesn't respond to simple home remedies, or you notice you're getting them more often than usual, talk to your doctor about making a trip to the clinic. It's important to rule out other possible causes of recurring headaches before assuming you're suffering from ulcerative colitis. 11. Loss of appetite. When people talk about the impact of a loss of appetite, they're usually talking about the health aspects. What they're really referring to are signs that something is amiss in the digestive tract. These can range from symptoms like nausea and vomiting to more serious ones like weight loss, abdominal pain, and bleeding. People with ulcerative colitis suffer from a decrease in appetite, or even an inability to eat at all, due to the inflammation of their digestive tract. In conclusion, ulcerative colitis causes inflammation of the colon and rectum and is sometimes accompanied by bloody diarrhea. It can cause severe pain, lead to fatigue, weight loss, and cramping. If left untreated, it can lead to colon cancer. The symptoms are similar to those of Crohn's disease, another form of inflammatory bowel disease. Both diseases are categorized as irritable bowel syndrome if they occur for at least 3 months a year over a 2-year period. The treatments differ, but both are treated with diet and medicine.